An unintended abolition. Anna Ahrens, an acting assistant law professor at New York University, stumbled across the unintended abolition of the child welfare system in New York City. It took place temporarily during the COVID-19 pandemic. When the city shut down in mid March 2020, so did its family policing apparatus. This system shrunk in almost every conceivable way as mandated reporters retreated, caseworkers adopted less intrusive investigatory tactics, and family courts constrained their operations, notes Ahrens. Reports fell, the numbers of cases filed in courts fell, and the number of children separated from their parents fell. At the time, ACS authorities and the media speculated, with no evidence to back them up, that the pandemic put children at risk of abuse because they were trapped in their homes outside the watchful gaze of social workers, teachers, and other mandated reporters. But ACS data showed precisely the opposite. The forced experiment in abolition didn't endanger children, it arguably kept them safer. Reports of physical or sexual abuse in New York City decreased dramatically during the pandemic. ACS investigations related to its child fatalities, which were required despite the lockdown, dropped by 25% between February 2019 and June 2019, and the same period in 2020. When the city bounced back in fall 2020, there was no deluge of child abuse cases that had gone unreported during the pandemic. ACS Commissioner David Hansel told the City Council that children remained equally safe in their homes during the shutdown as when family policing was in full effect. ACS data from the fall revealed that children stayed as safe with less surveillance, less government intrusion, and less family separation, Ahrens observes. New York City's children remain safe without ACS intervention because the pandemic generated more caring and effective ways to support families. Community-based groups sprang into action to provide tangible resources to residents who asked for assistance. By the end of July 2020, more than 15 mutual aid networks throughout the city were providing essential items like groceries and diapers and offering services like childcare and mental health care. They deployed hundreds of thousands of dollars to meet people's needs throughout the work of thousands of volunteers. The rapid expansion of mutual aid projects was breathtaking, writes Ahrens. Brooklyn-based Bed-Stuy Strong built a network of 2,700 volunteers within a month, and Crown Heights Mutual Aid made 1,300 grocery deliveries between mid-March and mid-May alone, Ahrens notes. The federal government also played a major role in keeping children safe during the pandemic. In April 2020, Congress rendered path-breaking support to impoverished families by passing the CARES Act. As part of a stimulus package, the act provided a one-time payment of $1,200 for adults earning less than $75,000 a year, with an additional $500 payment for each child under the age of 17 and $600 per week in extra unemployment benefits through the end of July 2020. It was the largest distribution of direct aid to the families in U.S. history and larger than all other non-retirement programs combined. The checks went directly to parents without strings attached, foregoing the investigation, surveillance, and regulation entailed in the child welfare programs. Though unintentional, this brief experiment shows that typical outsized and reactionary family regulation system is not necessary to protect children, Ahrens concludes. Abolition needs not to be a fantasy. New York City already made it, for a moment, a reality.